Hello and welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. We have a very special topic we'll be talking about today and a very special guest. But before I go ahead and introduce him, let me introduce a topic. We will be talking about strokes. Strokes in Nigeria, strokes among Black people. And again, we have some bad news for you. Strokes are worse in Africa as a whole. In fact, the new numbers say they are 2 to 3 times worse in Africa. Incidents now. The number of new cases are 2 to 3 times higher than that seen in the Western world and in the US. So you really want to pay attention to this topic. Now, what is a stroke? Stroke is what happens when there's loss of blood flow to a part of the brain as a result either of a blockage of the blood vessel or a rupture, as in the blood vessel just breaks up and blood flows out of the blood vessel into the brain. Either of them is terrible. The worst one is the latter. But bottom line is that we don't want strokes happening. And so we want to avoid them as much as possible. However, when strokes happen, and like I said, it's increasing rapidly in Africa and Nigeria, when they happen, it's best to manage them as effectively as possible. Now, if we're in the US or in the UK or in the developed worlds, usually within 6 hours, if you can catch it, most times, and it is caught because there's a good ambulance system and a good emergency response system, they're able to do certain things which will allow the brain to recover more quickly. We don't have that much, that advantage in Nigeria. So usually what happens is when the person has been stabilized, we want to know what to do to increase their chances of recovery in the long term. And that's what we'll be talking to you today. I want to introduce our guest. Our guest is Dr. Abayomi Salawu, who is based in the UK. And Doc, thank you so much for coming over.
Thank you very much for having me.
All right, let's talk about you. Tell us a little bit about you and what you do and what your interests are. By the way, folks, this was my Oga at the top when we were in medical school. When I came to medical school, he was already a house officer. He doesn't look that way. He looks very young, but serious Oga at the top. So go ahead, please.
Okay. Thank you very much. Well, as the host has already said, I'm Abayomi Salawu. I'm a consultant in rehabilitation medicine. I'm based in Yorkshire in the United Kingdom, but I train in Nigeria. And actually, before training in rehabilitation medicine, I have a background in surgery. I train also as an orthopedic surgeon. And one of the things I came to do in the UK was spinal surgery. And from spinal surgery, looking after people after spinal cord injury was how I got into rehabilitation medicine. Because once you repair people's spine, if the spinal cord is damaged, it's damaged. And what helps the people further down the line is the rehabilitation. Even though you fix the spine, they don't walk again. But the rehabilitation is what helps them to be able to manage their life going forward in terms of, and that kind of brings us to what we're talking about in terms of rehabilitation. Rehabilitation is the sum total of what we as clinicians do in conjunction with the patient and their caregivers. So it's not just only about clinicians, it's also with the patient and their support network to try and, if possible, help them recover from whatever might have happened to them, either be it a stroke, head injury, spinal cord injury, or whatever they've got, within the limits of some conditions don't allow for any recovery. I just use the example of a complete spinal cord damage, for instance, in that. Some allow for recovery. Some conditions are progressive. So people with Parkinson's disease, for instance, multiple sclerosis, they're progressive. In there. Some happen and they stay static, like cerebral palsy, for instance. But some of them will change as the person gets older, because that's what happens with human beings. So adapting and managing many of the residual deficits that come with all these is part of what we try and deal with in rehabilitation. And rehabilitation is not just only trying to get people, okay, you can function or you can get to the toilet and go. It's trying to restore the capacity to live meaningfully. You have to bear in mind, individuals are more than just their disease. Many of them are fathers, many of them are husbands, many of them are grandfathers. They want to return to different roles in there. And WHO captured this very well. They talk about the use of what we call functioning. So rehabilitation tries to restore functioning to the individual after they might have had pretty much a catastrophic or devastating injury or illness.
Interesting. And that is a huge thing. That's a huge task because of what we know about the brain and how difficult it is for the brain to recover. And so, what is the challenge that we see? I'm hearing you say this, and I'm thinking, okay, who's going to help to do that? We know that the main therapy group are the physical therapists or the physiotherapists, as we call them in Nigeria. They're the ones who, and of course, occupational therapists. I don't think we have too many of those in Nigeria. But what you are saying that you are a rehabilitation doctor, which is actually a medical doctor who focuses on doing what the physical therapists do, the occupational therapists do, but more than that. Tell us about what you do that is different from all that.
Yeah, the first thing I always tell a lot of people is this: those conditions that led to whatever the people have is a medical condition. Okay, so not just managing the initial, but also the ongoing management of those conditions. That's the first bit. Then secondly, many patients develop other medical issues as a consequence of the first thing they've had. So for instance, if you've had a stroke, almost 40% of stroke patients end up with depression at some point along the line. That needs to be managed. That might be a factor that will stop them from engaging in that. And again, if I use another example in terms of head injury, 18% of people post-head injury develop what we call pituitary hypothalamic, which is between the brain and the endocrine system dysfunction, which affects other things. I know we look at the brain, we think, oh, it only helps us to move and go in there. Actually, the brain controls everything we do as human beings, everything. Right. It controls the monthly cycle in a woman. It controls our thought. It controls everything. Your sleep pattern, your eating, your drinking, everything is controlled through the brain. And of all the things the brain does, if I oversimplify the brain function, it helps us to think, it helps us to move, and it helps us to feel. Of those three things, we only can control one, which is our movement. We can't control. If you say, I'm going to stop thinking, how do you do that? I'm going to stop feeling. If I pinch you, you're going to scream. You can't stop it. But you can decide not to move. And that's what separates us as human beings from all other animals, purposeful movement. I'm talking to you now and we're interacting, but all I'm doing in all reality is just moving muscles to make sounds. All I'm doing is controlling muscle movements in there. Right. And it's the ability to control those things that often is affected when the brain is damaged. So in terms of the rehabilitation, it's a multidisciplinary. So yes, you're right. You've mentioned the physical therapy component. There's also the occupational therapy, speech and language therapists, dietitian, in the clinical psychologists and neuropsychologists we work with, in the nurses. Now, people underestimate the impact of nursing care in rehabilitation. Most of the rehab in my unit is actually done by the nurses. The therapist spend maybe an hour with the patient, but that's 24 hours in a day. What happens the rest of the 23 hours? It's what the nurses are doing with them with the practice on the ward. And that's what makes a lot of all those patients better. So it's a huge group of people. And that's why rehab is very expensive, because it's labor intensive. I've just mentioned almost 6 different sets of professionals, all evolving around one particular patient.
Which is super difficult to come by if you're a stroke recovery patient in Nigeria. So before off camera, we were talking about these new developments that you and your team have come up with that can help individuals in terms of that 24 hours or that 23 hours when they're not seeing the doctor, things that they can do hopefully for themselves to help with this whole rehabilitation process. Because again, where I don't know if most people don't have occupational therapists, speech therapists, most hospitals don't have those things. Neuropsychologists, what the heck is that anyway? And I hate to say this about Nigeria, but we don't have those things. But what I was so excited about talking with you about was about this new development, this shall we say IT. Anyway, you would talk about it some more. But before you talk about that, let's talk a little bit more about that movement and why movement is so important, and then that will lead into what your discovery is and development is. You were saying that we don't want people to lie down in bed for too long, and we're talking about some time limits and some time periods. Let's talk about that.
Yeah, movement. I think movement is one of the key components that keep us healthy. Being able to move around, potter about, and move around. It's one of the key components in there. And if I kind of break it down into little small steps in there, the energy molecules our body uses, you and I know, we call it ATP, but let's just call it energy molecules. The body can produce the energy molecules in two ways, either with oxygen or without oxygen. Mm-hmm. The most efficient way for the body to produce it with oxygen is with oxygen, because for every molecule of the food we eat and it breaks it down, it will produce 2 molecules of energy without oxygen, but produces 36 with oxygen. So preferentially, the body prefers aerobic or with oxygen activity. Mm-hmm. How do we get the aerobic mechanism going? Through some of our activities. We breathe in air, okay? And moving around, aerobic activity, that's one of the things it does. Helps you to take in that, okay? Mm-hmm. Secondly, what we now know about muscles in the last couple of years is unbelievable. We now actually think of muscles as organs that are endocrine organs, not just only for movement. And I'll give you another example. Let's take something like diabetes, for instance. If somebody is in pre-diabetes state, if you do lifestyle measures, you can stop them progressing into diabetes. What do I mean by lifestyle pressure? We talk about nutrition. What else? Exercise.
Right.
And what's the exercise about? Muscle activity increases glucose utilization, independent of insulin. That is without even insulin.
Really?
Yeah, without even insulin. It's completely independent in terms of that, from the muscular contraction activity in there. That's why I said we now know increasingly on that getting the muscles to work has a lot of health benefits for us all. Now, if somebody falls ill for whatever reason, and you lose that ability to potter around, let's say you end up in what we call bed rest, which ironically we used to use as a form of treatment in those days. You put people on bed rest, one of the most dangerous things to do, because being sedentary is actually the biggest killer. And I will explain if we have time at some point in there. Now, if you take to bed, even without any injury, without anything in there, within 48 to 72 hours, our muscles start changing. It's that quick. It starts changing. First, in terms of function, then by the end of the week, you start getting morphological or changes in structure, okay? And what has been done in studies is looking at how long and how quickly people decondition. And to cut a long story short, 1 week of bed rest physiologically ages the body by 10 years. So if you lie in bed for a week, your body is 10 years older by the end of the week. Now, if somebody's had a stroke, most of them are going to end up in bed.
Exactly.
So by the end of the week, you're already fighting a losing battle to try and get the person. It's not irreversible. It's just that's what happens. And then 2 weeks, 20 years. 3 weeks, 30 years. By that time, so if you're 40 when you took to bed, 3 weeks later, you are still lying in bed, your body is now 70. If you then get up to try and do something, you struggle because you're trying to do what a 40-year-old would do with a 70-year-old's body.
Wait, explain that again. I mean, what? 30 years plus after 3 weeks?
Of bed rest. Enforced bed rest, not getting out, not doing anything. That's what happened. And that sets up a chronic inflammation within the body, again, within itself. And it's now actually what we call being sedentary, not moving around, is actually now a risk factor for most chronic diseases. Are you ready for this? Higher than smoking, higher than alcohol, higher than blood pressure.
That's bizarre.
It's
bizarre.
Unbelievable, isn't it? And it's simple things, because now one of my role is as an exercise physician, along with part of what I do. And when I explain to people, say one of the best treatment you can ever give people is to get them physically active. And that's part of why we do that in rehab, why we try to get the stroke patients or head injury patient out of bed, mobilize them quickly, because we know movement is life. There is an old saying, I don't know, can't remember whoever came up with it. It said, if you can't fly, run. If you can't run, walk. If you can't walk, crawl. But by all means, keep on moving. That is true.
Yeah, that's Martin Luther King. He said that.
Very, very true. It's as if I were to put all the benefits of being physically active and compare with all the different medications we have in the world, nothing has that same number over a wide spectrum of different conditions as being physically active.
That is crazy. Now, one quick question though. When you say the body ages, is it just the muscles?
No.
Or is it the bones? Okay, the bones
it's the physiology. Too? It's all the physiological response. The physiological response we all undergo. Say, if, for instance, now, if you get up to chase after something, your blood pressure will go up, your heart rate will increase to pump more blood so that you can do what you want to do. And then it will come down after that race or whatever in there. And that's what often affects. When people get older, we all say, oh, I can't do that anymore. It's your physiological response to exertion that aging affects. That's why if you just say, oh, if somebody, let's say you've got a teenage person who's running away from you, just say, oh, 20 years ago, I will have chased you and I will catch you. Why are you not able to catch the person? Because physiologically, your body can't respond unless you're a trained athlete. Right. So you have to keep up that. But as age catches up with all of us, but being inactive makes the effect of aging come across quick and faster. So if you have active, if you see people who live pretty much a old age, the elderly people, you'll find out that they're usually very active people. They were not necessarily running marathons or things like that, but they never sit still. They are very active people. And when you tell them, you go to say, oh, you shouldn't be doing that, they just look at you and say, okay, Motiba, or something like that. And then they go back and do the same thing because they know they can explain it. And there's I'm just going to kind of try this. We did some study a few years ago. I had one of my PhD students who worked on this, looking at whether we can use exercise to manage people after head injury. And it was based on there is a scientific basis for coming across in terms of that. And what my student did then was to enroll 12 patients. It's a small number of patients, and we ran them through 12 weeks of exercise. These are people with mild and moderate head injury, not the kind of head injury they operated on and anything in there. But there's something we call post-concussional symptoms, which people get after head injury. Fatigue, poor concentration, something similar to what people, brain fog and different things in there. So we ran them through a 12-week program of aerobic activity. All 12 improved. It was so interesting because when we then finished, many of the participants were now saying, no, they want to continue.
Wow.
They want to continue because they notice the improvement in thinking, in functioning, and a lot of all the other things. And this same thing happens in one group of people. And you will find this very interesting. You think of boxers, they get a lot of head injury by virtue of the rule. They get knocked. But what's been protecting most of them is because most of boxing training is aerobic training.
Mm.
A lot of what they do is more aerobic, stamina. The
Right.
best boxers are not the ones that can receive punches. The best boxers are the ones that can avoid being punched.
Right.
That's it.
Right.
Movement. This goes back to what I was talking about. I said everything in our brain is coded with movement. We think in movement, we talk in movement, we interact with movement. If I'm unable to move any part of my body and you're asking me questions and I can't respond, you're just going to say, oh, I don't think it's particularly sharp, just because I can't move to respond. I might be able to understand everything you're saying, but the moment that movement component is not there, and I'm talking of purposeful movement, because we exhibit behavior through movement, you act it out. So if all those things go, it has a significant impact. And that's why most of rehab, that's why the physiotherapy component is a big component, which is what everybody knows. So what you're trying to do is get the movement back and get the control back for people to be able to then control it. Then, yes, you might still have some deficits, but you'll be able to function with your deficits.
Hi, I'm Wafensi Goodness with the Brain and Body Foundation Clinic. Are you a parent of a child with sickle cell disease or any neurological disorder? I would love to invite you to our free clinics on Mondays and Fridays in Abuja, where we give free consultation and free supplements. And if you're outside Abuja, we can still get help to you wherever you are. For more information, please send a message to the number below, and don't forget to follow us on all social media platforms at Brain and Body Foundation for updates.
Correct. So I'm so glad we're going into this some more, and probably we have to bring you back, Doc, to talk about the discovery. But let's talk about. So I had, I think I posted on Facebook about a really nice video about sitting, and sitting being like you mentioned, worse than smoking and the other conditions. But what you're saying, and what really struck out to me about that study was that even if you decided to exercise, decided to move, even if you're exercising 3 to 4 times a week, if you're sitting a lot of the time, that exercise does not compensate or make up for that excessive sitting.
Absolutely. Absolutely.
Explain that. That's one of the strangest things I've ever seen.
Absolutely. In fact, one of what I say to people is this: if you go to the gym for 1 hour and pound the treadmill, and then you spend the next 8 hours sitting down to watch TV, you've canceled all the exercise you've done in the gym. Canceled it completely. And this is because, and I'm going to use one euphemism here, which many people, sometimes it triggers some people when I say it. I say life is not about survival of the fittest. It's survival of the moderately fit. And when I say that, people laugh. I said, yeah, we all can be super fit. We all can't be. That's why not all of us will run marathons. Not all of us will be Usain Bolt. No, but we all can be moderately fit. And the same thing happens in the animal kingdom. And I use one analogy a lot for people. I said, you go to the animal kingdom. What's the apex predator in the animal kingdom? The tigers and the lions. What's their life expectancy? Now let's go back. A tortoise. What's the life expectancy?
I read it's like 200 years or something.
Exactly. But if you've ever observed a tortoise in its natural habitat, they don't stand still. They're slow, but they're constantly moving.
Really?
Constantly moving. They eat, but they're moving. They eat and they move. So there is correlate in terms of that. And why does it do that? One of the things in terms of all the exercises and physical activity it does is one, it optimizes your cardiovascular system. It optimizes your respiratory system also. There's something we call the heart rate variability. Sorry, I'm using a lot of technical jargons and terms here. But basically, there's a syncing between our breathing in and the way our heart also pumps to extract the maximum amount of oxygen coming in. We have to bear in mind, there's only 20% of oxygen in the air we breathe in. It's not as if everything we breathe in is 100% oxygen. So the human body is evolved to be able to take, so we've got hemoglobin within our system that will carry 100% oxygen. to take it to wherever tissues that need to take it. We also only have a fixed amount of blood, 5 liters or 5.5 liters in an adult. And that's what needs to go round and round. So there has to be a good, efficient pump that will pump that around, pump it around regularly. And this pump doesn't sleep. If it sleeps, it's a disaster. Because it has to constantly function. And that's the same way with our brain also. In there, it has to also constantly function. Now, all this, if you look at our brain weighs less than 5% of our body weight. Far, far less than 5%. But what percentage of the blood does it take per minute of the amount of blood being pumped out by the heart? 20%. 1/5 of the blood, it out pumps out, goes to the brain. That tells you the level of activity going on in there. Places with high activity need a lot more blood.
All right, folks, you have heard a lot of good stuff, but if there's one thing I want you to take from this, I want you to take the fact that movement is critical, not just to overall cardiovascular health, but also to brain health. Do not spend your days sitting down. Even if you're an accountant or an attorney, or your office work is to sit down at the front of the desk, make sure you get up every hour or so to walk around, get that blood circulating around so that you don't fall prey to what Dr. Abayomi is talking about. So please, you've got to move around. This is one of our problems when when we grow older, we want everybody to do everything for us, even get the remote control, and we have people who are willing to do those things. You want to avoid that. You want to start going up the stairs by yourself and so on and so forth. Now, we're going to have Dr. Salawu back next week so we can talk more about how to have more effective rehab, not just from strokes, but from other things as well. So please stay tuned. If you've missed this episode, be sure to go to our website, brainandbodyfoundation.org, to catch up. And if you have any questions, always reach out to us through our website as well. And of course, if you want to get it on the NTA websites, the NTA has a YouTube channel as well. So God bless. Thank you for listening. Thank you again, Dr. Salawu, for being on the show with us. We shall hope to see you soon. God bless. Take care.
Thank you very much.